Hello, my name is Major Mike Webb, and welcome to Suicide Soccer, a visualization exercise. It stems from the uniquely military discipline area of force protection, which is exactly what it sounds like, keeping soldiers safe to complete a mission and return home safely to their family, friends, and loved ones. And for purposes of illustration, for the next few moments, we are going to be using this rather familiar game and example as a graphic representation of the COVID-19 pandemic. And just think of that goalpost at the far ends of a soccer field as your life and health. Well, we can think of that goalkeeper standing between the players on the field in front of the net, our invisible enemy for purposes of pandemic. But the goalkeeper is your extra layer of protection provided by a cloth facial covering, non-medical grade, to which many have actually improperly described as masks, which, probably understood, is the proper word for medical grade respiratory protection, quite distinct from what you have been mandated or even volunteered to wear. And at least in soccer, those who want to protect their goal probably want a fairly effective player standing in front of that net, not just the last guy chosen on the team to serve as the goalie. Especially for those who tend to be visual learners, I believe that example should be able to assist you in developing a visual image to help you to understand your situation in what has become a global public health crisis, the longest respiratory tract infection pandemic in history. Approaching the 4th anniversary of a pandemic virus in China, you may feel that you know everything that there is to know about masking guidance, but there's always, benefit from review. And also, by August 2020, early in the pandemic, the CDC was so concerned that many people did not appear to even understand the medical devices that they had been mandated to wear, that they had retained a cartoonist to create picture characters that a child in kindergarten could understand and demonstrate the locations, primarily, of the entrances to the upper respiratory tract, which should be a familiar word by now, for those who at least appear to believe that these locations were somewhere other than the nose and the mouth, based upon what they had observed in the field, seeing people wearing these non-medical grade facial coverings, substitutes for medical grade respiratory protection, and covering various parts of their body nowhere near their nose and mouth. And even more troubling is that in June 2020, before they had even resorted to the cartoonist for people in the general public, when the mandates began going into effect in Virginia, CDC had actually produced a similar informational brochure providing a very graphic illustration in about 4th grade graphic representation to assist those who were employed as public health workers in a respiratory tract infection pandemic, to help them to comprehend how these devices worked at the places where they were employed, around people who were sick and on the front lines. According to the CDC, 49 million Americans are age 65 and older, while 80% of deaths occurred among adults age over 65 years, with the highest percentage of severe outcomes among persons age over 85 or older. And after examining mortality in the pandemic, by February 2021, the journal Nature had determined that signs of respiratory failure were most prevalent with 88.5%, while in 57.7% patients had clinical signs of bacterial pneumonia. So there are 2 preliminary points for our goalie in suicide soccer here: age 65 or older and bacterial pneumonia after infection with a novel coronavirus. And viruses are not the same as bacteria, which should be a signal that the pneumonia is not being caused directly by the virus, because they are two different types of biological particles, as certainly any doctor knows. And during the Spanish flu pandemic, where over 90% of the fatalities were not from the H1N1 virus, but had resulted from pneumonia, bacterial pneumonia, aspirational pneumonia, doctors had concluded that this must be regarded as a secondary infection. Somebody else on the playing field, and may be entering through another route that may have a goalie, have no goalie covering for the event. Different team, different players, and joining forces with the invisible virus enemy in a tag team. Acute hypoxemic respiratory failure, AHRF, is a serious complication of SARS-CoV-2 infection, and where COVID-19 pneumonia leads to physiology typical of classic acute respiratory distress syndrome, ARDS. Hospital protocols have been using low tidal volume ventilation and prone positioning, or mechanical ventilation, to treat this complication. Pneumonia has been popularly associated with fatal outcomes in the COVID-19 pandemic, and in January 2023, the Journal of the American Medical Association, or JAMA, had published a peer-reviewed study that had determined that after examining 719 ventilated patients between March 1st, 2020 and June 30th, 2021, they concluded that mechanically ventilated patients with severe COVID-19 pneumonia experienced a longer duration of mechanical ventilation, longer time on the respirator, compared with patients with pneumonia from other etiologies. And that while not to a statistically significant degree, patients with COVID-19 pneumonia had somewhat lower rates of being discharged from the hospital alive in 90 days, again to die, than those with non-COVID-19 pneumonia. And for an idea of mortality demographics, these patients with COVID-19 were more likely to be male, belong to minoritized racial groups, and have diabetes, as well as a higher mean BMI. So if at least 57% of the fatalities, primarily age 65 or older, are dying not from an infection by a novel virus, but an aspirational pneumonia, a bacterial infection, the priority of fire question for your extra layer of protection grade goalie out front is whether or not that mask you are wearing is making sure that the bacteria is not getting through to your goal. Is it in the air? And while many fact checkers have insisted, along with Dr. Fauci, that he had never said that the mask had caused any death during the Spanish flu pandemic, just delivered the knockout punch, a doctor knows that aspirational pneumonia is caused by anaerobic bacteria that is aspired from the gastrointestinal area and that is inhaled into the respiratory tract. And so if a patient has this gastrointestinal bacteria inside him or her, and it is being regurgitated or coming up into his mouth or nose, that hydrophilic absorption properties of that covering that has been used for source control, at least after the Spanish flu pandemic of 1918, or as a simple barrier to prevent an infected person from infecting others, blocking at least 90% of the droplets that might be expelled in the direction of others, you have basically opened a B&B for bacteria, a bacteria blocker over your mouth and nose, so that you can redirect those contaminants expelled from your digestive tract system when you inhale them into your respiratory tract system, introducing the aspirational pneumonia responsible for at least 57% of the fatal outcomes in the COVID-19 infection, over 90% of the fatalities during the Spanish flu pandemic. It's generally not a good thing when your goalie is helping the other team and you look like an intelligent person.
This message was approved by Major Mike Webb. Honest.
And you look like an intelligent person.